Welcome to this episode of the THT podcast. We've got another fantastic guest for you, Dr. Malcolm Kendrick, and he's a GP in England, living just south of Manchester in Macclesfield. He's a specific interest in medical research data and wrote the book Doctoring Data to try to help people understand medical research, how data can be manipulated to provide certain answers. He's also been researching, writing and lecturing on heart disease for many years. He's written the books The Great Cholesterol Con and A Statin Nation. He has a blog called drmalcolmkendrick.org. He became interested in the COVID-19 pandemic early on this year and has tried to help people understand what's actually going on, which is increasingly difficult as the research and the data become horribly distorted. Welcome to the THT podcast, Malcolm. How are you doing, sir?
Yeah, I'm fine. Early in the morning. Hopefully I'm wide awake enough to answer a few questions.
Good stuff. Excellent. So tell us a little bit about your journey, Malcolm. How did you get from where you started to where you are now?
Well, essentially, many years ago, I became interested in heart disease, and I was living in Scotland. Well, I was at medical school in Scotland, and Scotland had the highest rate of heart disease in the world at the time. And it became very clear when I started looking at it that the ideas didn't fully understand, didn't fully explain heart disease. I mean, I went to France, and France had the highest amount of saturated fat consumption in Europe and the lowest rate of heart disease, etc., etc. So I started researching, became very interested. And as you do this, you start to think, you know what, this research, some of it doesn't make any sense to me. And as you dig deeper and deeper and find out more and more, you think, crikey, you know. So I've become a bit of a skeptic of medical research and the data that are presented, and I'm always looking at it and thinking, why did they use the word new, or why did they phrase it in that way? Because everything is very carefully presented to us. And I think once COVID kicked off and I started seeing the language and the words and the statistics used, I began to think, we're not being given the full information here. We're just not being told really what's going on. So I suppose I've become a kind of a natural skeptic. In fact, I was reading a paper, it was a very famous paper by a researcher called Johnny Anadis, who about 15 years ago, the most widely read research paper in the world. It's called Why Most Research Findings Are False. And you think, well, that's unfortunately, it's become true. And there's the word false. I mean, people use it, almost the language doesn't fully encompass the concept of false, true, lie, manipulation. It's all very subtle in many cases. But the reality is, we're often fed a narrative and lied about things, and you have to dig down very deep to find out really what's going on. So I'm a sort of I'm the kind of the skeptic's skeptic, if you like. Such a thing exists.
Cool, excellent. So one of the books you wrote, the Big Cholesterol Con. I remember years ago I read a book of a similar nature, I would imagine, called The Cholesterol Myth.
Yeah.
Tell us a little bit about that, the book that you wrote.
Well, yeah, I mean, actually, The Cholesterol Myth was written by Ophir Avneskov, who years ago came to the same conclusions as I come to, which is a lot of the stuff we're told about heart disease is just plain blank wrong. He established a group called the International Network of Cholesterol Skeptics, which is then called Thinks. I said, we're not really cholesterol skeptics. We think cholesterol is a good thing. We're kind of the other way around, but never mind. You know, it's quite a good moniker. And so there's a group of researchers, including myself and doctors, and we write papers and we lecture and we talk and we write books and we get together and we try to chip away at the edifice that is what we call the cholesterol hypothesis, namely cholesterol causes heart disease. And I think we're making some progress. It's a bit like when people say, what are you doing? And I say, I'm helping to build a cathedral. I'm doing the pillar on the right, and I don't expect I'll ever see this thing finished, but at least I know it's being built, and at some point somebody will be able to say, you know what, actually cholesterol hypothesis is not correct, and these guys were right all along. I'll rise from my grave and shout, I told you so, in about 100 years perhaps. And that's kind of where we're at the moment. Yeah.
Cool. And how big an industry is the statin industry?
Well, the statin industry has moved on really, because statins were first launched, I think 1987 was the first statin to launch in the market. It was a long time ago now, actually. It was like 33 years, correct? It's amazing. And statins have sold approximately $1 trillion worth over their lifetime. There's been several different statins lowering cholesterol. There's other cholesterol lowering medications around now, so the market's kind of moved on. I mean, statin, once a drug loses its patent protection, then anyone can make it, and the price of it, sort of, if it started at whatever, $500 a year, it goes down to about $50 a year, and the margins are moving from huge profit to slender profits. So statins don't really make vast sums of money, although in the States, one statin alone still makes $3 billion a year in profit. Quite how they've managed to achieve that, I don't know, but they do. So what we're now moved on to is new injectable drugs. I don't know if you've heard of them. They're called PCSK9 inhibitors. You don't need to know what that stands for. It's enormously complicated. But basically, they lower cholesterol or LDL in a completely different way. Now, statins at their peak were maybe £1 a day. These drugs are, you're talking, when they first launched, £12,000 a year. So, I mean, if everybody taking a statin moved to these, that would be the entire budget of the NHS gone. And there are other medications coming through. So this market is not going. It's expanding in some ways. It's changing. So it's still worth billions and billions and billions of dollars, and therefore is protected. I mean, the other side to this is, of course, the cholesterol lowering foods. I mean, the pharmaceutical industry is not alone. The food industry, you'll have heard about Benical and all these things, and lower cholesterol naturally with diet and all that sort of stuff. I mean, I have no idea what that market is worth, but the low-fat diet is worth, I would have thought it must be worth it must have been worth $1 trillion as well. It's possibly even bigger. So there are vast commercial interests in keeping the entire keep your cholesterol down, lower it with this, that, and the other thing market. It's vast, and so really you are a bit like, I sometimes liken myself to firing a pea shooter at a tank and going, take that, and the tank just rolls on completely unaffected by my ruthless pea shooter attacks on it. So, but I think people have begun to realize that the dietary stuff has become damaging. There's no doubt that the dietary guidelines that were introduced, which was reduce saturated fat, lower your cholesterol, which you can talk about that forever. Since that time, the level of obesity in the West has gone up from not very much to huge amounts. Diabetes has become enormously prevalent, and whilst it's not the only player, I think a very major player, because we stopped people eating fat, and then we told people to eat carbohydrates instead. Now, fine, carbohydrates are not naturally dangerous, but once you start eating lots of carbohydrates, you become obese. That's just what happens. And so actually the dietary advice has been completely wrong. So there has been some movement in people saying, well, actually this demonization of fats is really been a major mistake. So I think that there is a movement there, and once the movement starts there, then it naturally progresses. Well, if that doesn't make sense, this doesn't make sense, and then that doesn't make sense. Okay, we've got you, if you like. So it's sometimes a rather thankless task, but I have learned an awful lot about reading clinical studies and looking at medical research. So as I say, it's stood me in certain good stead in other areas as well.
Excellent. Now, we both know how useful and how important cholesterol is in the body. For those people that perhaps don't yet know about the functions of cholesterol, for example, if somebody's on statins for a long time, what are the potential side effects of lowering that cholesterol?
Well, as you know, when anyone is looked into this area, I mean, the vast majority of cholesterol in your body is synthesized by your liver. It makes probably 5 to 6 times as much as you'll ever eat, unless you sit and eat 20 eggs a day or whatever it is. So it has a purpose. It has an enormous amount of functions around your body. It's probably the single most important. No, it's probably water is probably a bit more important, but leaving aside water and sodium, okay, it's not the most important, but it's an incredibly important substance. The body uses it. It's kind of building block for many, many different things. Almost many of your hormones are made out of it: estrogen, testosterone, cortisol. These hormones are synthesized from cholesterol, which your body absolutely requires. It is also very important within every cell membrane. contains quite a lot of cholesterol, which acts to keep the environment and the functioning of the membrane healthy, and allows certain things to get into the cell and out of the cell. So the function of cholesterol, I mean, if you had no cholesterol in your body, the first thing that would happen is that your cells would disintegrate, because cholesterol holds them together, and without it, you would just die. It's also very important, hugely important in your neurons, because your neurons are surrounded by what they call a myelin sheath, which is kind of helps the transmission of nerves, and this is very high concentrations of cholesterol. In fact, within your brain manufactures its own cholesterol, because cholesterol can't cross from your blood into your brain for various reasons. There's a thing called the blood-brain barrier. So your brain has to make its own cholesterol, and it fires it out into the cells and helps to keep the neurons alive and healthy. And in fact, one of the other really important functions of cholesterol is it forms your synapses, the connections between neurons in your brain. Very high concentrations of cholesterol, and without cholesterol, you can't form new synapses. So you just essentially, if you got rid of cholesterol or lower it down, there's a danger of damage to your nerve cells, inability to create memories, breakdown of the nerve system. Along with that, obviously, you know, the hormones in your body. And I suppose at the moment with COVID, importantly, vitamin D, which many people and myself have been banging on about vitamin D as being protective against infections and keeping your level high. Well, vitamin D is synthesized in your skin by the action of sunlight from cholesterol. So, you know, this idea that this is some deadly, dangerous substance in your body that has to be lowered and has to be reduced is completely insane. Why, you know, I say to people, why do you think your body makes it all day, every day, and can't get enough in the diet and has to manufacture it itself? So, I mean, you know, just from a basic kind of, don't think about it too deeply. You've got to have this stuff. It has to exist in your body. You've got to have enough. So if you start knocking the levels down over time, you know, what's going to happen? Your damage will occur. And we can see that people can be damaged with it. I mean, it increases due to a very complicated thing to do with your pancreas. It reduces the synthesis and creation of insulin in your beta cells in your pancreas. So, you know, let's not say the very strong, this inarguable, very strong evidence that statins increase the risk of type 2 diabetes through all sorts of actions. So, yes, they have some benefits which are nothing to do with the lowering of cholesterol, in my opinion. They're what they call off-target effects. So in medicine, you call these pleiotropic effects. So you give, you know, classically, aspirin was used to lower temperature and anti-inflammatory, and then they discovered it reduced the risk of heart disease through a completely different action. And now they've discovered it reduces the risk of cancer through a completely different action. So when you look at statins and you say, okay, they lower the LDL level, it's not really cholesterol. What else do they do? Well, last time I looked, I found 52 different off-target effects of statins, any or all of which could explain what impact they might have on heart disease reduction. So if you like, the cholesterol reduction is just an unpleasant adverse effect, which would be nice if we could get rid of that and get the other effects of statins. So, you know, and people look at this, and of course, you have arguments about this with people, and they go, well, don't talk rubbish. And you go, well, look at the latest drugs, the PCSK9 inhibitors. They lower cholesterol far more than statins do. And when you look at the results from the clinical studies, there was no impact on cardiovascular death, none. In fact, it went up slightly. So we have, there's just been a recent meta-analysis review of PCSK inhibitors, and as they say, these new drugs appear to contradict the cholesterol hypothesis. In fact, they do contradict the cholesterol hypothesis. There's been many other drugs that have lowered cholesterol apart from statins, and statins are standalone as the cholesterol-lowering drugs that have an impact on heart disease. None of the others have shown these positive impacts. So, you know, it's quite clear that the hypothesis has actually been contradicted by the clinical studies, but it's amazing what people will not believe if they don't wish to believe it. So I think that, you know, yes, moving back to the original question, without getting off track too much, you need cholesterol. It is essential. Why do you want to lower it? What are you doing? You know, and you know, I've looked at study after study. We did a paper 2 years ago, the Thinks group, of which I was one of the authors, and we demonstrated that, especially once you're after the age of about 50, 55, because people do studies at different ages, so you can't say a definite, distinct age, because there is no cut-off point. One of them does it over 50, one does over 65, one does over 60. But anyway, once you get past middle age, the higher your cholesterol, LDL, low density lipoprotein level is, the longer you live. That's it. Every single study, the longer you live. So whatever else lowering your cholesterol does, it certainly doesn't make you live any longer at that age. So, the data is like overwhelming in a way. And yet, you can go on and on about it and go, as far as I'm concerned, this is inarguable, all right? But of course, other people have, unfortunately, think that I'm talking nonsense, and they're correct. What does it say there? You ever see the film Inception? The most powerful parasite is an idea. And I believe that now very, very strongly. It's not just about money, it's about ideas. This idea is very potent. You eat cholesterol, you eat fat, you raise your cholesterol level, you die of heart disease because it clogs up your arteries. It's a very simple idea, people love it. And it's like, this is the siren song of the simple idea. As I say, drags researchers to their doom because they can't get it out of their heads. It's like a Boney M song. Once it's in there, it's a mind worm. It goes round and round and round. You think, for God's sake, stop singing "Brown Girl Goes in the Ring" or whatever it is in your head, because it's going to drive you insane, and you're going to have to drink lots of beer to get rid of it. So it's but these ideas, they're incredibly powerful, right? So yes, we have digressed somewhat, but there we go.
Excellent. So yeah, I mean, that was very well explained. Thanks for that, Malcolm. So in terms of in your GP practice, what have you noticed, or what should I say, what have you found to be the case in the reporting of COVID-19 deaths? Because it appears from the outside that these stats that get reported are far from accurate.
Well, I think we've reached a point where the statistics themselves have, I don't know if you can make any meaning of them. I mean, at the start, when I've done a few death certificates for elderly people, because I deal with nursing homes as well a lot now. I've moved out of, not entirely, but out of mainstream practice. But I'm dealing with elderly patients a lot of them are on many medications. But anyway, some of them died. And I did death certificate, but we weren't allowed to test for these people at the start. You were not allowed to test for COVID. The only tests that were available were for people entering hospital. So we have no idea if these people had COVID or not. Now, some of them died in a very unusual way. They looked quite well. Their oxygen levels dropped, but they died. I haven't seen this form of death before. I don't think I have ever, and I've seen quite a lot of people at their end stages of their lives. So I don't think there's any doubt that COVID's around. I don't think there's any doubt some people died of COVID. But did that patient die of COVID? Did that patient die of COVID? I mean, if you took my death certificates out, the figures would drop by about 8 for COVID. I mean, I did put COVID in. I don't know if they died of COVID or not. I don't know. So, we were kind of instructed almost to put the information on. At one point in the middle of the COVID epidemic, it was suggested that relatives fill in death certificates. But not many people know this. I don't think it ever happened. But we got to the point where doctors weren't going out to see the patients. Patients were ending up dying. Nobody really knew what they died of. People weren't, were told to stay apart. I mean, relatives filling in death certificates. I'm interested to know what they would have put on, died of turning blue, anyway, you think, oh, that's ridiculous. But I mean, a lot of patients were never seen by the doctor. They died, they were told by the staff in a nursing home, they died, and they said, oh, what do you think? Oh, it might have been COVID. So there's no doubt there was an a number of death certificates saying people died of COVID that they didn't. Mind you, there might be other death certificates saying people didn't die of COVID when they did. I don't know that for sure. So that statistic is difficult. The other statistic is difficult, of course, is that's the dying of, and is the dying with, and is the dying because of. So I say, did this patient die of COVID? Well, that's quite a difficult thing to know, because if they were otherwise unwell and they had diabetes and chronic obstructive pulmonary disease and heart disease and whatever they had, what actually did they die of? I think people have become aware recently that actually it's quite difficult to put this on a death certificate. It's not like some super precise thing. An elderly person dies, it's like, I don't really know what they died of. So let's say, well, what have they had previously? They've had a previous heart attack, so it's probably a heart attack. That's how it goes. All right. I mean, doctors will run around going, no, 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 it's not like that. It's far more accurate than that. It's not the case. All right. I know, because I do these things, and I speak to the coroners and say, I don't know why they died. And they go, well, why do you think they died? Because they don't know what to do postmortems on everybody. So I go, well, they've had type 2 diabetes and they look like they might have had a chest infection, so we'll put this down as chronic obstructive pulmonary disease or whatever. So I mean, it's not precise. And the other problem with this, of course, is because of a lot of people who are dying who are very unwell in other ways. So they have multiple other conditions. And in fact, in the States, the Center for Communicable Diseases, which is kind of the great high priests of this area, admitted in the US that only 6% of people who died of COVID died purely of COVID. They had nothing else wrong with them. So that means all of the others had other things wrong with them. So when they die, what did they die of? There's an example, which is prostate cancer, which I don't know if you're aware of, which is most men who die, who've got prostate cancer, die with prostate cancer. They've got it on board. They don't die of it. They die of something else. If somebody with prostate cancer has a heart attack, I'm not going to go, oh, they died of prostate cancer. I'm not even going to put that on the death certificate. It's not even going to be mentioned, nor should it be. But we have with COVID, somebody gets a positive COVID swab. And you've seen examples, people who were in hospital in ICU got a positive COVID swab, and then were put down as COVID on their death certificate as a cause, primary cause. So the figures say, people where COVID, I'm not sure, I can't remember the wording, it's just escaping me, had a role. So in a death certificate, you can have 3 primary causes and 2 secondary causes. But on this, whenever COVID is mentioned at any point, that's a COVID-related death. But if someone was in ITU for 4 weeks, then they did a swab, then they found COVID, then they died. Did they die of COVID? I have no idea. Who knows? Nobody knows the answer to that question. But of course, once something becomes the recognized diagnosis, then and you're putting it on, it becomes a thing. So, who actually, how many people died of COVID? We don't know. All right. It probably got to be approximately the right number, because the ones that were that we didn't know and they didn't put it on but were, and the ones that we did know, anyway, probably just about cancelled each other out, I think. I don't know. But when you're coming to look back on it, this makes it incredibly difficult to analyze the data. What do we know happened? So at the moment, of course, we have the huge problem of where we're doing swabs on people and saying that these are COVID cases. And we're saying this is a case of COVID because you put a swab up someone's nose, you find some particles of viral matter, you multiply them up time and time and time and time again, so you get, oh, look, that's bits of coronavirus. Well, they're a case of COVID. And you go, well, they're not a case of COVID, because a case throughout history has been somebody who's ill with the disease. But these people are not ill with the disease. These are people carrying it around who are not ill. And that viral particle can last for ages. Very, very early on, when we first were allowed to test in nursing homes, one of the staff members got a positive test, who was completely well, who was self-isolating, who then got another test that was positive, who got another test that was positive, who had a positive test for 8 weeks in a row with no symptoms whatsoever. So you think, well, what does that mean? Does that mean they're infected? How would you define that? We've never done this with any disease before. If we did an influenza epidemic year and started swabbing everyone for influenza, I'm sure we'd find there was lots of cases. There was lots of positive swabs for influenza kicking around. Do we know this? Well, we don't know this. I can say that I would think this probably would happen. So we're caught at the moment in terminology problems. At the start of the epidemic, it was like 5,000 cases maximum a day. We're now heading for 5,000 cases. In fact, France has got more cases now than it had at the start of the epidemic. But in France, at the start of the epidemic, the cases went like this, or the positive swabs went like this, and the deaths went like that. And now, in August, the swabs have gone like this, and the death rate has gone like this. It hasn't moved at all. So what, what do people make of this? No one even goes to explain, well, of course, the more and more people you test, the more and more people who don't have symptoms you test. So we're in the middle of a kind of testing epidemic at the moment, and trying to get people to understand these things. It's, oh my God, we've had 120 cases in Bolton, we must lock it down. It's like, how many people are admitted to ICU? That hasn't gone up. How many people are dying? That hasn't gone up. So these cases are not turning into seriously ill people. I mean, that's just one area, but the whole area of the figures and what these things mean, people just seem to have lost control of the narrative, and we're being terrified by positive smalls, whatever they might mean,
Yeah, it's fascinating that with the different terminology of cases and stuff that you were talking about there. I've got a good idea what the end game has always been from the beginning of this epidemic in inverted commas. What do you reckon is the end game, and what's the motivator behind that, do you reckon?
Well, I think never accuse anyone of being part of a conspiracy, because at that point you can be dismissed instantaneously. Oh, you're just a conspiracy theorist. And I say I've never believed in conspiracy as the only driver of human behavior. There is not some shadowy Dr. No figure at the middle stroking his white cat and saying, "Now, Mr. Bond, we are going to control the whole world and you're all going to die," or whatever. That doesn't happen. Right? First of all, no one's got enough organizational ability to do that. So everybody else in his organization would be bumbling around going, "What was it we were supposed to be doing?" I have no idea. But there is a conspiracy, and I call it conspiracy of the willing. First of all, once people are frightened, once people are fearful, then realistically, governments can do what they like. We know this is the case. So the people want to be protected. The public wish to be protected, and if you keep talking about cases and whatever, then they will continue to want to be protected, and will shout down anyone who says this is nonsense. Doctors want to protect people. That's their job. And if people are telling them they have to do this to protect people, they're going to continue to do this because they want to do this. This is what they do. They want to help people. Politicians love to stand around going, "We're protecting you. Look how wonderful we are. We're the great guys. We're protecting you." And also they don't want to admit that they've got it horribly wrong. But behind the scenes, yes, there are people who are going to make eye-wateringly huge sums of money out of this. If we do get a vaccine, then we're going to vaccinate the whole world. Well, we're never going to vaccinate the whole world, but say we're trying to vaccinate 5 billion people. First company comes out of the vaccine, what are they going to charge for it? They charge what they bloody like. Let's say they charge $50. 50 times 5 billion is 250 billion. Repeat next year, repeat the year after. This would make Apple and Amazon and it look like big players in the world of commerce. 250 billion a year, of which 220 billion a year would be profit. There is no company gets anywhere near that. So yes, there are people in the background who can see very clearly where this ends up, and this ends up with them becoming enormously rich, just beyond the dreams of Croesus rich. So these people, and they've got contacts with they've always had the contacts, they've always had the influence. The pharmaceutical industry in America spends some unbelievably ridiculous amount, and I believe more than all the other industries put together in lobbying Congress and Senate and politicians. It's not quite as huge in the UK, it just isn't. But these people have vast influence. These people work with the opinion leaders. If you want to be an opinion leader, if you want to be at the top of the tree in medical research, you have to work with the pharmaceutical industry, because they're the only ones with the money to set up and run the big clinical trials. And the only way you're going to be an opinion leader is if you're seen to lead a big clinical trial. So these guys, they know you, they speak to you, you speak to them. So there is an enormous amount of top level influencing going on. And whilst I don't think politicians want to destroy the entire economy of the Western world, they're being told basically this disease is still terrible, it's not gone, we're still killing lots and lots of people, we have to get a vaccine, we have to get commercial pharmaceutical treatments for it. So I mean, yes, if you want to say it's a conspiracy, the vast majority of people aren't part of this conspiracy, but it is being driven. I was just saying to my son on the telephone last night, and I remember the story of Chicken Little. you know, the sky is falling, we're all going to die. So the interesting character in that is Foxy Loxy. Doesn't appear in some of the versions. Foxy Loxy was the one that threw the eggshell at Chicken Little's head in the first place. Chicken Little went off and scared the world, and Foxy Loxy goes, yes, I can protect you because I have a lair that you can all come into. And in the end, all the animals end up in Foxy Loxy's lair and get eaten. So I think it's a good parable for what is actually going on here. You know, everyone's running around panicking, and one guy says, I can save you. Come here, my little friends. You know, by the way, my delicious little friends, you look really delicious. And so I think we are, I think we're a bit being, Foxy Loxy is definitely wandering about in the undergrowth, inviting everyone into his lair. There's no doubt about that. Does that make it a conspiracy? This is just stuff that happens. You know, as I say, I don't blame the pharmaceutical industry for trying to make money. That's what they do. You know, it's like blaming, you know, as Benjamin Franklin said, you know, what is the freedom? Freedom is freedom of the sheep, is freedom to wander around eating grass and not to be attacked and killed. What is freedom of the wolf? Freedom of the wolf is to attack and kill the sheep. They can't both have freedom. Our freedoms require that we have shepherds to protect the sheep from the wolf. Trouble is, at present, the shepherds are being paid vast sums of money, or being wined and dined by the wolves to allow free access to the sheep, which is really, unfortunately, I think where we have found ourselves. And in a world where the wolves will want to eat the sheep, and the shepherds have become not sheep defenders but wolf defenders, you know, we're in a very dangerous state, I think, with this, and this is proving again and again to be the case, you know.
Yeah, I love your analogies and stories, Malcolm. They're really good. That Foxy Loxy one was very cool. In terms of being a family practitioner yourself, with regards to this vaccine that's supposedly around the corner, what's your standpoint on you giving it to your patients? Do you have any choice in that matter?
Well, there won't be any choice. I mean, it would be I think you would be King Canute if you stood on the beach and said, you know, I'm against this tide. I'm against this tide. I mean, there's a part of me says, look, if they just create, you know, water and say this is a vaccine and give it to people so that the whole thing comes to an end from that perspective, you know, I'd support it, because we've locked ourselves into a place that it's very hard to see how we get out of. So I mean, from one aspect, bring it on, quick as possible. From another aspect, rushing vaccines, you know, it's almost like vaccines are the great holy trinity of, you know, truth, liberty, and whatever. And people really believe that no vaccine can do harm and all vaccines are beneficial. I mean, this is not true in development phases. That, you know, the hit rate apparently is 250 to 1. So, you know, for every one that's found to be safe and effective, 249 are found to be not safe or effective, and therefore have to be removed from the research system. So, you know, we're rushing these things. And, you know, I don't think we do enough safety testing on vaccines anyway. And I don't think we do enough efficacy testing on vaccines anyway. This is a major issue that's a long-standing issue. But when this comes in, you know, the Russian one at the moment is, you know, they're giving it out to people. They didn't even do a phase 3 trial. They didn't even test it for safety. You know, would you take it? I damn well wouldn't. You know, coronaviruses, they've used them in cats for a form of really nasty disease that they get. They've been trying to develop a coronavirus vaccine for this for years. And what they found was that if you give it when they get the actual infection, it triggers a greater immune response. And actually, the cats are more likely to die if they take the coronavirus vaccine. The coronaviruses seem particularly to create this very strong immune response, and the vaccine creates a very strong immune response. And if you've already got it on board, it seems that you can double this response. I mean, they are aware of this danger. I was listening to Science on Radio 4 driving back from work last night, and we were talking about this. But, you know, being aware of it, you know, they say that this vaccine trial from Oxford has been halted, but this is quite normal. We normally halt trials. That's not true. Trials are not normally halted, not like this, all right? And they're all telling you, oh, this is quite normal, it's nothing to worry about. You know, a halting of a trial normally would preclude that's the end of that trial. all right? And I fear that there's such a pressure to drive this thing forward that the case, I mean, it was lateral sclerosis. You don't know what that is, but you don't want it. Of all the neurological conditions, that comes pretty high up. Really, really horrible thing. Basically means your spinal cord starts falling to pieces. All right. Now some people get this condition. We don't know why. It's probably thought to be due to it is due to some form of immune response to some form, probably of a virus. So you can see why they panicked, because this is an immune response to a vaccine. Are the two things related? It's not impossible, but you don't want to get this. Okay, this is not good. So will they just override it? Because it's very easy to say, you got 10,000 people being given a vaccine. Just naturally, normally, some people will develop nasty things, got nothing to do with the vaccine. So how can you tell it was the vaccine? That's very difficult. You get one case, you can't really tell that's the case. You've almost got to see 2 or 3 or 4. And then you're into the kind of, well, this would normally never be seen at this level. So I think they'll just trigger it back on again. And then they will say, oh, well, it's just coincidental. And it's just coincidental. Because the pressure is so vast, both financially and from the government and from the public and from everyone to make a successful vaccine. When people were telling me, there'll be a vaccine available by September at the start of this, I just wrote back and said, you are mad. I said, well, if there is a vaccine available in September, I won't be taking it. And I won't be advising anyone else takes it, because it cannot have gone through sufficient safety and efficacy studies to be certain that it is not going to be significantly unpleasant for you and could cause nasty side effects and adverse effects. So at what point do we say, well, it seems to be safe enough? I mean, in America, they have I can't remember the name of it, but it's an emergency something act, which basically says you don't need to do safety and efficacy studies on these, because the disease is so deadly that we must get it out. We're going to override all those normal safety protocols. I don't know if they've actually done it, but they are talking about doing it, in which case it's like, well, I am definitely not taking that. All right. Always speaking personally, I was exposed from day one to COVID. I had nurses coughing over me directly, that far apart, face to face, in treatment rooms. One of them whom was coughing away, and I said, you don't look very well. She'd had a swab the day before, and she went off ill, and the swab came back positive. That happened to me twice. No mask or anything. We weren't allowed to wear masks at the start. So personally, I believe I have some immunity, but of course, I've been dosing myself up with vitamin D from the start and going out in the sun. So I do believe vitamin D is incredibly important to not allowing this virus to get hold in your system. And I would promote that very strongly, very, very strongly. I know the powers that be have just decided you can't talk about vitamins, you can't talk about vitamins. It's absolute nonsense. There's hugely important and powerful evidence demonstrating that vitamin D protects you against COVID and virtually any other form of viral infection, and they're just basically shutting that research down. If you dare put anything on Facebook, apparently Facebook take you off. I mean, what? Vitamin D, what's the worst it can do? It doesn't work. That's the worst it can do to you, unless you drop a large pot on your foot and break your toe or something. What's the best thing it can do? The best thing it can do is it stops you getting COVID and dying. The BAME community, the Black Asian minority community in this country, have very low levels of vitamin D in general because they have dark skin and they don't synthesize much vitamin D because of this. So, this is clearly something that should be looked at, and they've looked at everything else to do as why this community is more likely to die from COVID, but they will not look at their vitamin D. It's just, I mean, it's like, no, we are not looking at this. We're just not looking at this. It's quite extraordinary. And, things like that are deeply worrying because, at the very start of this thing, I said, I gave some advice and I said, well, what's going to protect you against, COVID? I said, I don't know because it's very new. I said, but there is some strong evidence that vitamin D is protective against all viral infections, as is vitamin C, as is hydroxychloroquine, which has been used to prevent viral infections for a long time and has some very important, potentially important effects. The hydroxychloroquine, bam, it's like this is a drug that's I think, being prescribed to more people around the world than any other single drug, even statins. It is extraordinarily safe. It's still used. We still prescribe it for people with rheumatoid arthritis and Crohn's disease and whatever anti-inflammatory. And yet it's become a deadly drug that cannot even be used in a clinical trial. You can't even do a clinical trial in it any longer. I mean, it's, you know, that stuff is very, very upsetting, because, you know, we I think could be giving people beneficial medications. You know, simple things like zinc. Well, zinc helps hydroxychloroquine get into the cells, and da-da-di-da. You know, the technical stuff is very, very complex. And yet we are, what are we doing? You know, we're stopping all these things. And you say, is there a conspiracy behind this? In this case, I think there's a very clear drive by the people making very expensive antivirals at $5,000 a course, who do not want anyone to be using anything that you can buy over the counter virtually. And they have been, unfortunately, very influential in driving groups like the World Health Organization, who have become incredibly dependent on getting money from individual sponsors, because various governments like the US government have pulled out. So, you know, the World Health Organization, I would have said, you know, when it started off, was an extremely effective and important organization. But it's become almost a political organization, not a medical organization anymore. So, you know, the stuff that they now say, I hate to say it, but when the World Health Organization says something about COVID, I just ignore it, because I don't believe that they are unbiased. I think they have become very biased in this area.
Oh, there's no doubt about it. If you just look at who the big donors are, it's largely made up of private investors and big pharma. Massive conflict of interests for sure. It's been fascinating to have a chat with you on the THT podcast, Malcolm. Thank you so much for taking out the time from because I know you're really, really busy. So thank you so much for being on the show with us. No problem. It's been good fun, and I hope we can have some effect on the world. Well, luckily, I mean, I do know the last blog I did on this got 300,000 hits. I did an article on it. I mean, ironically, I now do articles in Russia Today as the only news outlet that will actually publish anything critical of lockdown or COVID. Such a thing should happen. My last blog talking about COVID got 400,000 views. No. So it was a great people are, so we're talking getting close to 1 million people. So people are waking up to this, I think, eventually. Thank goodness that is. Anyway, I hope. Absolutely. Yeah. I mean, let's keep putting out good information to help people make better choices. So I appreciate your time, mate. Okay. Where is the best place that people can find you online? What is the URL? Probably my blog. I think drmalcolmkendrick.org. It's a WordPress blog. So far, I haven't been censored or shut down. Although an awful lot of people are now telling me that their posts do not appear on. I mean, I normally see all the posts, so I have to approve them, which is another bit of a deep joy. Because some people write things that are longer than my blogs, you know, and which I just go, oh, God. Anyway, but I would say that a lot of people are saying that they can't post any longer. On your website? On my website. Yeah. Interesting. Okay. I say, why are you censoring me? I say, I've never censored. If someone makes a personal insult, I don't put it up. You know, if someone advertises something, I don't put it up. If someone writes something utterly incomprehensible, I don't put it up. So if I don't censor anyone for saying you're wrong or whatever, I said, I don't do that. This is a debate. This is where people can say, I hope, where they feel they can say stuff that they feel is true, and then other people can discuss it and debate it. I'm not there to censor people's views. You know, I get enough of it for myself to know that just because I think something's idiotic, maybe it's true, you know. So, but I'm getting censorship, you know. Okay. Through on a private website. That's interesting. Yeah. Okay. What was the name of your website one more time, mate? It's drmalcolmkendrick.org. I mean, if you put in Malcolm Kendrick, it'll come up. So if you just stick my name in Google or whatever, you'll get there very easily. Excellent. Thanks again, mate. Have a fantastic day, because I know you're going off to practice now, aren't you? Yeah, I'm off to, yes. Save the world. Nice one. Have a good day. Thanks again, mate. Bye-bye. Cheers.